Should be very relaxed.
Oh, I'm sorry. Good day, Folsom Nagwin here to Relax the Talk. Stay tuned to learn more about how osteopathic medicine can help you.
And don't let back pain keep you from a good night's rest.
That's right. We are here learning more about osteopathic medicine. Got an actual patient here to give us his take on it and how it might be able to help you as well.
And speaking of sleeping well, Nat Wynn joins us live from Folsom, where she's learning techniques to deal with back and neck pain. Hey, Nat.
Yes, this is so interesting to me. So in the beginning of the show, the doctor actually did some techniques on me, and I feel way lighter. I don't know how to explain other than the concept is manipulation. He touches your body, moves it, kind of puts it back into the right place. We have Tony here. Tony's been a patient for a few years, came in with neck pain. How has it changed compared to other places that you've been to with what you've been working with Dr. West?
Well, with my back and neck, I just really couldn't get any relief in the manipulation. I mean, I walk out of here, you'll be able to see how much I can move my neck after he...
And I think that's important. If we can see, can you show us real quick the difference between your left? So he's getting, we said about 70 degrees each side, and that will change.
75, 80 to the left.
Okay. And so I'm going to let you start, and I'm going to talk a little bit about, so we were talking about sleep. If you want to start treating Dr. West, we can show him. So earlier we did sleep relaxation techniques, things to help people sleep better. And something Dr. West pointed out is that if you have neck, if you have back problems, it all correlates. You probably have a bit of difficulty sleeping. And what's important with osteopathic medicine is it deals with the holistic, the holistic care. And the way that Dr. West equated to me earlier, which I think is so important, here you hear it now, is that it's like fine-tuning a car. You're a car and you need to do the checkups in order to run and function properly. So what he's doing right now, he's going through the manipulations and basically readjusting Tony so that he feels basically in line and in tune with the rest of his body. So I'm going to let you, there we go.
No, Marianne, you can't do
Now,
that.
I wanted to ask Dr. West something also is, we were talking about the difference between this and some other treatments. Somebody's going to look at this and think it's very similar to something else.
Right.
But what is the big difference?
Is that we go to medical school, 4 years of training, 3 years of residency for family practice, internal medicine, and then other subspecialties can be 7 years fellowship, surgery. So we go to medical school. Osteopathic medicine was started by an MD, Dr. Andrew Taylor Still, who was the first DO, or Doctor of Osteopathic Medicine, and started the manipulative or manipulation techniques. And then there are some other practices that came out of that.
So how far along are we in Tony's treatment right now?
We're getting close to being done. We're doing his thoracic vertebra right now and his ribs, which he had out. Deep breath, let it out. And again, let it out. And this is just using very subtle movements. It's called high velocity, low amplitude techniques. And now I'm going to do his cervical vertebra.
Okay, and then after this we can kind of see the difference between his rotation, right?
Right. Let your breath out and drop your shoulders. And then again, let your breath out and drop your shoulders. Okay? And that's not...
I don't know if you can hear that.
I heard
it's
it.
just a little... Yeah.
Realigning his musculoskeletal system, which is the bones, the muscles, and the nerves. And that helps the entire body restore its structure, function, and wellness.
Real quick, do you mind sitting up and we can see before, just real fast, the difference between... That's way more than earlier. So if you guys are interested in finding a DO in your area, that number popped up. Cody, you should definitely give him a call and at least try it. I feel like it's something people don't really know about, and it's worth trying.
You can see his face, all the color. That's called oxygen. So DO also stands for delivers oxygen to the cells.
All right, back over you guys. Something to check out, definitely.
Thank you so much.
You feel a lot better.
Oh, yeah. Look at him. He looks sleepy now. He's like, oh. Time now for court.